saw trauma as an issue, not realizing it was initially trauma. Um, Through my training as a resident in emergency medicine and then also practicing here in Philadelphia, I saw a lot of young people come through the emergency department that were shot, stabbed, assaulted, and the status quo is to quickly fix them up and send them back out into the street. And there was something that was lacking there. And the sad thing about that, we were patching them up because medical care is sophisticated, it's fantastic. But we often would see them back, either shot, stabbed, assaulted again, or in some instances dead. So there was something that was missing from the continuum of care for that particular population. That's when I started to delve a little deeper to see what could possibly work for the young people that we were seeing that were violently injured. And then I realized that there's more to it than just the wound itself. It goes so much deeper in terms of their exposure to violence, their experience of trauma on a regular basis, something that's chronic that happens to them. And it not only impacts their behavior, it impacts their health. And it took me a while to really understand that, and it was through the work of John Rich in Boston and his collecting of stories of young people that have been impacted by violence, and then Sandy Bloom, who also recognized how trauma and adversity really have huge impact on a person's physiology. When I think about what made me realize that trauma was so huge was I'll do it in two. There are two different scenarios. One was when I realized that some of my colleagues, healthcare providers, agency supervisors, really only saw it in terms of bad kids or sick kids, and they didn't understand the depth. And quite frankly, I didn't understand the depth until I listened to the stories of some of the young people that I interacted with. Fast forward probably 10 years later, when we were able to develop a program, Healing Hurt People, which is a hospital-based violence prevention program, identifies young people or people that have been victims of interpersonal violence, and we wraparound services, and they're professional services. We connect them with primary care, we connect them with specialty care, we provide some case management as well as behavioral health counseling. And we saw how wrapping those services around an individual, getting deeper, recognizing how a person that lives in poverty, who doesn't have the opportunity to pay for a caretaker of their children, who misses an appointment. In our world, we see that as someone just misses an appointment and they're irresponsible, they're not accountable. But we don't consider all of the forces that go against that individual. Working with young people and helping them move forward. And we have examples of two amazing young people that we were fortunate to work with and bring them through the program, provide them with those services that I described. And now they actually work for us, part-time, because they're also in school part-time. But getting them to envision a future, recognize their safety, how to manage their safety, how to deal with their emotions, and also deal with loss. I'm talking about this acronym called SELF, Safety, Emotional Management, Loss, and Future, which is really what governs the way that Healing Hurt People works with individuals. These young people are amazing in that they have embraced that, they practice that, and it allowed them to progress to another place where they're envisioning a future in a big way. And we're just thrilled to to work with them and to see them grow and to see them continue to grow. Healing Hurt People is the only hospital-based program that is trauma-informed. Or I should say we are the first trauma-informed hospital-based violence prevention intervention program. It required buy-in by the hospital administration, and we see our work going in, it's bi-directional in some ways, in that we're providing direct services to patients/clients, while at the same time we're educating other healthcare providers, public health professionals, around the importance to embed trauma-informed practices in their day-to-day activities, especially working in an institution that's surrounded by, unfortunately, a pretty impoverished population. So we have been successful, I would say, in establishing the program, getting buy-in. We have to constantly remind providers to make the referral to our program, in that they forget, because they get caught up in the knife stab wound or the injury, and forget about some of the other things that could prevent them from coming back to the emergency department. So, like I said, it's bi-directional in that we're providing some information and education to healthcare providers and professionals and public health professionals, hospital administrators, while at the same time providing some direct services. Something that's really exciting and important is our opportunity to expand this work into other level 1 trauma centers across the city. Philadelphia is interesting in that we're a population of about 1.5 million, and we have roughly 5 level 1 trauma centers throughout the city. And I'm missing one of the pediatric facilities. And so our goal is really to make this a standard of care, in that we have professionals that are working with what would be considered a marginalized population to get them into primary care, so that they're not overutilizers or superutilizers, but get to take advantage of the services that they're deserving of. We are currently at Temple, and currently we're at St. Christopher's Hospital for Children and Hahnemann Hospital, which are the teaching hospitals for Drexel. We have since replicated at Temple University Hospital. We started at Einstein, and we're about to hire the team at Penn Presby. We're working to make that happen at Jefferson as well. I've seen change in the care provided to a population that has often been disregarded or tossed away. I've seen agency leaders recognize the importance of being inclusive rather than exclusive. I've also seen the value added to the individuals that we take care of on a day-to-day basis. They're human, just like us, and I think when we scale away the biases that again many of us I've had in the past, they're just human beings just like the rest of us, and they're in need of support. They just don't know how to access it. I would offer to other cities, other universities, other agencies that are taking this approach to caring for individuals as trying to put yourself out of business. No one wants to see and care for a young person that's been shot, stabbed, or assaulted, but we do want to see them thrive. We want to see them succeed, and it's worth the investment of providing those services and making sure that those services are available. And when I sometimes I think it's missed when I say services, I'm talking more specifically about case management, navigating individuals and families to the services of, heating. Some people don't have heat in their homes, and that contributes to a whole other slew of problems. I'm talking about making a person aware of what would be best for them or what could help them. I'm also talking about trained individuals that have the skill to provide trauma-informed behavioral health counseling, non-judgmentally and compassionately and empathetically, so that the young person, I'd say the young person, but I mean the people and their families will succeed. The next steps to inform public policy in Philadelphia are to ensure that there are reimbursements for such services that I've been going on about. I think we have neglected to look at this as a bundled type of service, that this should go along with regular medical care, and it's not a side piece, because when we get into that, we start to piecemeal, and it discourages the providers themselves who are getting those reimbursements. And we are in a pretty interesting time with the Affordable Care Act and the emphasis on community health workers and the possibility of their reimbursement schedules and how that might work. So really advocating that such services, specifically trauma-informed services, and those services need to be held accountable through these agencies that are delivering, or I wouldn't say delivering, through the agencies that are responsible for the reimbursements. Make sure that the providers are doing those things. That's no small feat, but it is something that we should work toward and can work toward. In 10 or 15 years from now, Philadelphia as a trauma-informed city, there would be a greater collaboration. There would be a recognition of institutions as anchors within their communities, and the city agencies would be behind these institutions. And I'm speaking about Temple University, Drexel University, Penn, Jefferson. So there's a theme here. So I'm talking about these level 1 trauma centers that are paired with these academic institutions, where there's an exchange between the communities and the institutions, one that's valued and appreciated, so that these are these anchors, and they're supported by the city agencies to make sure that care is being provided, services are being provided to the community, but in exchange, the community is able to take advantage of what those institutions have: employment, counseling services. And it's also interesting in that I want to speak about public health education as well as medical education, because there's more and more a confluence of the need that medical education needs to include population health and public health. And medical students and healthcare providers need to be aware of the community that they're serving and what their needs are. So there's a mutual benefit to be as open to the community as the community takes advantage of the resources that the institution has. I mentioned that Healing Hurt People is a violence intervention prevention program that's based out of Hahnemann's Emergency Department and St. Christopher's Emergency Department. And it's really a staff of social workers that are working with individuals that have experienced trauma, violence, and adversity. We encourage our providers to identify the patients and refer them to our team. In some ways, it's like a consult service. And it's trauma-informed, it provides wraparound services, it provides case management as well as behavioral health counseling. the I would say the force behind this is the Department of Behavioral Health. The force, the funding, the buy-in, the support. Dr. Arthur Evans, who is the commissioner for the Department of Behavioral Health, has a vision to help us disseminate the program to these other institutions throughout the city so that we can, again, be bidirectional in our work in terms of providing these services, these core services to patients and families, while at the same time educating the healthcare providers, the public health practitioners, the healthcare executives of the importance of trauma, adversity, and stress, and how paying attention to those core issues really do help promote health.